Hello, thank you very much for the opportunity to present at this conference. My presentation offers a technology governance perspective on patient data, and I hope it will help understand some of the problems that were addressed in the previous presentations. So there are, as we all know, numerous examples in the digitalization of patient information in healthcare systems. A long time ago, the introduction of computers in doctors' offices, electronic patient ID cards, and digital sharing of diagnostic reports, diagnostic imaging, and telemedicine and telecare. And there are several very old debates on how this impacts the work of doctors and the patient experience, such as, for example, making physicians' work more difficult, increasing the risk of error, and the necessity for human input, which will always be necessary for the contextualization of digital data on patients. Electronic health platforms and systems such as the electronic patient record system, ELGA in Austria, is intended to go far beyond sectoral boundaries of health to social and elderly care, to people's homes via telecare and telemedicine, which connects previously separately financed and managed organizational entities and disconnected regions and federal states, which increases the complexity of the system as well as the uncertainty associated with the technological impacts on society. A really patient-centered system, of course, has the potential to support health and social care. What is perhaps new in the technological developments of the huge leaps in data processing that have occurred in recent decades is the scale of data protection and the increase in algorithmic decision making, the dynamic expansion in applications and functions, and the increase in connections and thereby interdependencies between previously less connected sectors, services, and regions. However, given these opportunities, still not everything that is technically possible is also used by patients and clinicians. The implementations of these national information system programs is highly resource intensive, and very, very little opportunity is taken for genuinely democratic and responsible technology governance and implementation of these innovations. The debates on technology governance and the relationship between technology and society and societal impacts of technological change is not new, but there have been some recent contributions that have raised this issue again at the EU policy levels. I would like to start with the most famous example of the Collingridge dilemma, which highlights the problem of controlling technology at different stages of implementation. At the beginning, risks are unknown, and as well as the complexity of estimating impacts is not known. But by the time the innovation process has continued, control has been costly and slow because of technological lock-in and path dependencies that have arisen. The responsible innovation framework is one that has been most recently emphasized by von Schomburg and Owen and Stilgo and colleagues, which calls for an responsible process for informing technology governance, which will increase its societal resilience. And this is one of these approaches. Suggestions is through open and inclusive anticipation, reflection, and inclusion processes that increase the responsiveness of the innovation to societal needs and the solution of social problems. There are perhaps three main reasons why public health technology governance and societal impact are misaligned. One is the increasingly large health information systems that affect entire population sectors and regions, such as, for example, the electronic patient record implementation in Austria affects the entire population. All people have social health insurance. However, the decision-making for this process has been highly centralized and linear. The advances in data collection and algorithmic decision-making, again, affecting entire populations, are characterized by secrecy, and the expansion of applications in different domains is also remains relatively unquestioned, the dominant view being innovation is always good. Specifically for the ELGA case, the inclusion of laypersons and diverse stakeholders and users in the design process was limited to 2 or 3 meetings at the beginning of the implementation, which was perhaps in the first year. And the user interface evaluations were limited to asking users how user-friendly the software is. And these discussions were not planned as a regular part of the implementation process for the future. And one of the people who I interviewed who were central in implementing this system in Austria described these meetings as people were invited and they could ask questions. So it was these user exchanges are sort of framed as describing and informing rather than trying to understand the needs of patients and integrating these needs into the innovation process. A further point I would like to make is the linear way in which these complex technological systems are implemented. One of the actors I interviewed said that the process started with the formation of a committee of key persons, then a working group followed, then a legal entity was formed, and the conversations between these organizations and specialists and ministries were the main sources of dialogue to get okays for every step in the information process. A further interesting view was that in order to push forward this process at the beginning, a cost-benefit analysis was done in which was given a lot of weight, where benefit was considered to be equal to savings potential. So the benefit of the entire system was described as a savings potential. Of course, this is not the only view that was considered, but it was one that was very, very important. A further point I would like to make is that data collection and algorithmic decision making in this process is the political vision that is used to inform the implementation of this system doesn't reflect the technological innovation, which affects the entire population now and for the future. And there is definitely a reduction in a reduced and narrow perspective of what these kinds of systems actually are and have the potential to be. In one interviewee's views, it is nothing more than the exchange of findings. And of course, it is much, much more than that. A further feature of the secrecy of ALGA implementation is that it was because of the formation of this ALGA company, the legal entity for the electronic patient record system in Austria. The algorithm itself was treated as a business secret. So there was no open discussion about the various decision points that are included in this algorithm or its testing in the broader community, which would have increased security and safety of the system. Finally, the expansion implications of these systems, they are considered to be something that needs to be pushed forward quite quickly, so that the people who are involved in its implementation, there's a difference between what is perhaps in this responsible innovation process relevant, which is the incremental implementation of these innovation systems, where at every stage in the process, questions are asked, dialogues are fostered between societal actors, and evaluations are made about the acceptability and the social benefit for these functions, which is sort of not as important as the need for the speed for the implementation of these systems and their expansion. So for the future, it would be very important to open up opportunities for responsible innovation in public health technology governance, such as integrating social anticipation, reflexivity, inclusion, and responsiveness processes in the implementation process that accompany the implementation process and its expansion at every stage, and that they are considered an integral part of the process, and which would ensure or which would increase the probability that technological change benefits society, and because it will be enabled through open democratic processes. Thank you very, very much for your interest, and I look forward to your questions.